By now you may have seen my video where I'm describing mesotherapy. It's a non-surgical alternative to liposuction for small areas of fat pockets that you're trying to get rid of. Now, mesotherapy is a medical treatment where we have medications that we inject into small fat pockets to get those fat cells in those areas to shrink down in size. If you can imagine the fat cell being a plump, juicy grape, what we're doing with the mesotherapy injections is reducing those plump, juicy grapes to raisins. In the process, over the period of weeks after the injection, those cells get progressively smaller and your unwanted fat pocket shrinks down in size. Now, the ideal candidate for mesotherapy is the patient that we have today. She's a normal-sized patient. She works out, she eats well, she does all the right things, but just like most of us, we still have little problem areas that we'd like to improve. In her particular case, it's going to be here, the central part of her tummy and the lower part of the tummy. And we're going to be injecting medications once again into this area to gradually get those fat cells to shrink down in size, and for this little unwanted fat that she has here on her tummy to decrease in volume. Now, the mesotherapy is done with medications somewhat similar to what's used in Kybella, except much stronger. And unlike the Kybella treatments that are FDA approved for treating fat pockets underneath the chin, mesotherapy can be used anywhere on the body where you would like to reduce unwanted fat. Now, we start here with a special massage technique. I'm going to be squeezing and shaking the area as I'm doing the injections. That way you don't feel the tiny needle that's used to introduce the medicine into the fat cells. Okay, are you ready?
Yes, I'm ready.
Okay, we'll start here with just a little blow, like that. How was that?
It was good.
Okay, so we're going to continue. We're going to do one roll after another. We're going in that direction, we'll come back in the opposite direction. We typically don't use topical anesthetic. It's not necessary because the needle is so small, and the shaking technique kind of sends vibration signals to the brain so that the little poke of the needle isn't unnecessarily uncomfortable. After the procedure, you typically aren't sore because there's actually anesthetic in the medication itself. You can see that the areas that have been injected are already looking a little bit flush, responding to the medication. And that's it. We're all done.
That was very comfortable.
So this is a mesotherapy treatment. Are you having any pain at all right now when I'm not poking on you?
No.
Okay, and that's the way it should be. You may notice just a little bit of redness. We're going to conclude the procedure by putting a little bit of hydrocortisone cream over the area. That helps with any itching sensation that people may have. Sometimes people have a little bit of an itchy sensation. The procedure is very safe. The main potential risks and complications: number one, you can have a little bruise. Number two, there's always a potential for infection whenever you start breaking the skin, and that's why we cleanse everything off with alcohol. And with this procedure, it's a very nice alternative if you have patience and realistic expectations to gradually reduce small fat pockets without scarring and without surgery and with no downtime. That's mesotherapy for fat loss.